So, to use Darren's well-worn phrase, without further ado, which I'm not going to because that's a cliche.
I have to put my glasses on.
So welcome back. Hope you've enjoyed lunch and a stretch of your legs. We have 2 workshops running simultaneously. And you can't get out of going to both of them because the workshop's going to come to you. But if you want to start with statistics, you need to go downstairs. If you don't want to start with statistics, you want to start with the mental health collaboration, and the work we're doing to build capacity in mental health research and implementation, then we are starting that here. So I want to welcome Catherine Berzins and George Georgiou, who are going to do a workshop for us over the next 45 minutes on building capacity in mental health research and implementation, something very dear to my heart, because it took most of my summer a year ago writing the bid to get the money.
Welcome to everybody, and thanks for, well, I was going to say thanks for coming, but you've got no choice, have you? So, so my name's Catherine Berzins, and I'm a research fellow in the Impact team, and I'm also the manager of the Mental Health Roundtable, and that's the kind of system of governance for this initiative, which is why I'm talking about it. What we're going to do is myself and George are just going to hopefully provide an overview of some of the opportunities we've got available. We're going to give you a bit of background and context. We're going to give some information about the internships we have on offer, the fellowships we've got on offer, and we're going to talk about how they relate to the ARC themes of health inequalities and public involvement, and then finally talk through the application process so that people who are interested in applying, or people that you know that might be interested in applying, you can pass that information on. So George is just going to give a very brief background about the ARC in general and the capacity building.
So I'm not used to using a microphone. I'm used to shouting at people. So if I am shouting at you, please do tell me. So I'm George Georgiou. I'm one of the research capacity delivery managers for ARC North West Coast. I share that role with Colette Miller, who sadly isn't here today. So I'm just going to give you a bit of a background around what we've done in the past as regard the capacity building offer and the Clark and now the ARC. So if you cast your minds back to those of you that were around in the Clark, we had somewhere in the region of 70 interns over the 5 years of the Clark. And we're around 35, 37 interns now in the ARC. So at the 2.5-year mark, we're going to easily match that figure. And bear in mind, that was during a pandemic as well. We were still getting people coming forward that were working in health and social care who wanted to apply for these opportunities. We've done various offers over the years. Within the Clark, it was around research, small research projects, and then the partner priority program, which we felt was a good model, and we delivered quite a lot of implementations and evaluations over that. But we're going to describe the offer to you this afternoon of what the current internship offer is, and then we're going to add to the mental health capacity building offer to that.
Great, thank you. So part of the background to the mental health capacity building work is that, as Mark said, he wrote an application for some extra funding that was to develop mental health research capacity, and that was £750,000 additional funding that was awarded to quite a few of the ARCs last year, specifically to increase mental health research capacity. And the way that that's being administered in North West Coast is through the establishment of the Mental Health Roundtable. And that sort of provides oversight for the additional funding. I just want to briefly describe that. I mean, as it sounds, it brings together key individuals and stakeholders with expertise in mental health from academia, health, social care, third sector, community and voluntary organisations, and of course patients and public advisors with lived experience of mental health services. And it's a forum through which it's got lots of roles, but one of its roles is to support this capacity building and to kind of administer how the extra funding is spent. So one of its key objectives is to identify promising outline proposals for research and innovation that match up with priority areas of need, identify champions in the workforce to develop as researchers, and as a result of this, kind of enhance the ARC infrastructure, resources and processes to produce collaborative, relevant, high quality mental health grant applications, and collaborate also with other ARCs and HEIs, not just within North West Coast. So one of the main ways that this is being put into practice is what we're focusing on today, and that's through providing a number of research internships that are focused on mental health and wellbeing. And these are targeted at the health and social care workforce in our ARC member organisations. And secondly, by providing some mental health early career researcher development fellowship money. And this is targeted at established researchers, either from a clinical or academic background. So George is just going to talk a bit about the existing internship scheme, because that's been running for several years and will continue to run. So he's just going to describe that, and then we'll talk a bit more about the specific mental health offer.
So thanks, Catherine. So some of you may know this, some of you may not. As part of the internship offer, there is the salary backfill that we offer to the member organisation of £6,000 to buy out that person's time so they can dedicate it to the project. We put an agreement in place with the employer that says I will try and guarantee George's day a week, 2 days a month to work on this project. The research must fit under one of our existing research themes. It must address health inequalities or identify and address health inequalities. It must involve public advisors. We always make this point, and it comes up at the interview as well. There will be an interview. We asked for a 5-minute presentation, and we have been known to refuse interns in the past if they don't succeed at interview. So it isn't a carte blanche approach that there is to the internship. As it says up there, the intern carries out a 1-year project. It could be less. It depends on the type of internship. For instance, if they're preparing a fellowship application, that could be condensed into 6 months, particularly if the deadline is in March and they've started in September. Some interns choose to carry on past that period, and we've got a good example at the moment of an intern, and I'll talk about that in a minute. We provide them with a training program. Now that could be an academic qualification, as in a master's module, or we develop bespoke training around research methodology. There will be an academic supervisor or two in some cases. We found that some of them need a clinical supervision within their employing organisation and an academic supervisor. And then there's the outputs from it. It's usually a report or a presentation, which they could do the presentation to their service. We used to do something called a showcase. We'll be resurrecting those to bring the interns together to present their findings to you all. And hopefully that will happen later on this year, now that we're back to the more face-to-face activity. We're always looking for more bang for our buck. If there's a publication or a conference presentation, we will support the interns to go to conferences, for instance. We will support them to produce manuscripts, obviously with the ARC disclaimer, Darren, on there, so that we can count it as another output from the ARC. So that there is a well-defined programme that we've delivered successfully through the Clark, and now we're doing that with the ARC.
Thanks, George. So in addition to that, we've got this ring-fenced funds to provide additional internships, and we think this will be approximately 9 additional ones over the next 2 years. As long as they're mental health or wellbeing related. And I think George's already mentioned the backfill, so there's £6,000 salary backfill available, and the application form presentation interview process. And we have got dates for that in terms of the closing date for the applications for that scheme is the 11th of July, with interviews the following week on the 18th of July. In terms of eligibility, any staff member from any, or public advisor from any of the ARC members of any level can apply. People don't need previous research training or experience. And what they do need is management support to be released 1 day a week from their service for the 12 months, if that's applicable to them. Obviously, there's a range of benefits in undertaking an internship. There's the kind of personal development benefits in terms of, increasing your research, implementation and evaluation, knowledge and experience. There's the benefit of the supervision and support from academic staff, and the opportunity to work alongside other interns. So that's because of the nature of the offer, that's often very multidisciplinary. So there's learning to be gained there, and of course it increases the research capacity and capability of the member organisation, because that person then takes that knowledge and experience back to their service. George is just going to talk a bit about the specific process in terms of, how an internship develops from an initial idea through to being an actual project.
So we're going to talk about the examples of the current offer. So one of the internships that we're supporting at the moment, one of the programs of internships, has been around small research projects. And we currently have a cohort of, I think it's 8 interns going through the research internship process. They proposed a small project to us at interview, and if it fit under the existing research themes, addressed health inequalities, it was something that was important to their organisation, important to them, important to their patients and service users. We asked all those questions at the interview with the presentation. They are going through the process now of developing their research question and methods. They're meeting regularly with their supervisors. Catherine, I don't know if you want to sort of give an example of how you're supporting one of the interns with his project. And they are supported with a training programme that's been delivered by the ARC staff. And as I said before, they're monthly sessions. They're quite intense. We have them over Teams. It's a whole day and there's a lot to learn, but we are recording these sessions as well so that interns can go back and refresh their memories on what's been delivered. So I don't know if you just want to share.
Yeah, I think just from the perspective of a supervisor, it's hopefully it's quite reassuring that when the interns first start, they have an idea and a kind of suggestion, but that's by no means set in stone, because it hasn't been picked apart in the way that it needs to be to decide whether it's going to work as a small research project. So that's something I've been doing with one of the interns recently, which as you'd expect, has involved several iterations of what he wants to look at and why, and how's the best way of looking at that. And it really is like starting as basic as that. So people don't have to come with a fully formed idea. It's more like, I'm interested in this. I think this is the way to go ahead with it, but I'm not sure. And there's plenty of scope to discuss that and work out, what's going to work for that person. And hopefully it's within a kind of supportive environment rather than, people feeling sort of challenged or expected to have all the answers at the start, because it just isn't like that. So like I say, people shouldn't be put off by thinking that they're not, they don't have a formed research question at this point, because we will support people with that.
What I will say about the current bunch of interns going through the research internship process is they all came full of enthusiasm, and that enthusiasm is still there now. So it's a good sign that they are finding some benefit from going through the internship process. It's a 12-month process, though, so they will be delivering something at the end of that time. They are getting support, not just from their supervisors. The capacity building team is always there to discuss things with them as well. So we don't just abandon them and say, off you go, work with your supervisors. Come back to us and discuss things with us. Teams has actually been a blessing in many ways for us, because we can randomly talk to people about their projects as they're going along.
We've got George is going to talk in a bit more detail about some concrete examples of internships, because I think that's always helpful for people to hear about. But we've just got a summary of the, a kind of overview of the offer in this diagram. So it shows that there are different types of studies. So it might be a data science study, it might be an evidence synthesis, it might be a small research project, or an evaluation or quality improvement project. But regardless of the type of study, everybody gets academic supervision, and people, depending on their individual needs, would be offered access to a, introduction to research methods course or an implementation course, and they're master's level modules that are hosted at UCLan. And again, the outputs will vary depending on the type of project and what the needs of the individual intern are. So some of those on the bottom line might be a poster presentation, might be a paper, or a service-specific report or implementation plan. So it can be very flexible to accommodate what people are interested in, what they want to produce as a result. So George is going to talk about some of the examples of different intern projects that we've had. So I'll hand back over to George.
So we're going to look at some case studies of the rapid conversion evidence summaries that we've done, the RACEs. We're going to look at an example of a data science internship. We're going to look at an example of a research internship and of a fellowship development. And we've tried to look at what the existing cohort and what we've supported in the past. So everything's got a bit of a mental health slant to it as well, because that is supposed to be the theme for our session today. So first things first, I was so pleased to see Abby here today and to give her a presentation on her RACEs project, and she's still smiling, she's still enjoying it, and she's partway through the implementation science module. So she's here today presenting. Tomorrow she'll be attending the classes for that as well. But that was nice to see. So one of the current interns that we're supporting, we've got 3 doctors, an advanced practitioner and a speech and language therapist. One of the doctors is looking at the rapid evidence summary of the effects of COVID-19 on maternal mental health. So she's been working with the MIDAS team, with Joe and with James, to identify a systematic review. I think in her case, they identified more than one systematic review, if I'm not mistaken, and she will be publishing more than one evidence summary. So she's doing very well. She's been assigned a supervisor as well who's working with her, who loves working with her. She's many times she said to me, she's great to work with. She's currently completing the Masters in Implementation Science, and she's developing an implementation plan. Now, she was sort of a rabbit in the headlights the other week when we were going through the module, saying, do I have to deliver all of this by the end of the module? As in, go away, do an implementation and evaluate that implementation. And we reassured her and said, no, the output from the module is, how would you go about doing this implementation? What steps would you follow? So it's given her a bit of a sigh of relief, because they do feel overwhelmed. So we're there to reassure them again. We can talk to them over Teams and say, no, you're okay. You're working clinically. We recognise that, but you're still trying to find a day a week of your time to actually develop this implementation. Next slide, please. Data science is something that the CHI team has been supporting. So the data science internships. And again, we were approached by someone who is a data analyst in one of the NHS Trust member organisations, and he was interested in looking at what the impact was over time on the COVID pandemic, of COVID on levels of demand and access to the mental health services within that trust. So he's been working with both Lancaster University and the team at Liverpool, the CHI team, and they did analyse the data and they presented that to the trust. I can't tell you what the output is at the moment because they are intending on presenting that soon at a conference, so they're intending on publishing that. But one of his other wishes from the internship was he wanted to be upskilled in something called Python, which is around data transformation and analysis and visualization. And that's where the CHI team at Liverpool University came in, and they provided him with that training as well. I also pleasingly found out the other week that he was working quite closely with one of the ARC PhD students as well, so there was a collaboration going on between one of the interns and the PhD student. So again, quite an effective relationship going on there with the member organisation working across different academic or departments within the ARC. Fellowship development. Now, many years ago, in the dying days of the clerk, we supported a mental health nurse to apply for a pre-doctoral clinical academic fellowship, and they were quite new at around that time. And she did a lot of work. I'm not going to lie, I've never seen anyone work so hard in the time that we supported her. She was networking, she was going to conferences, she was presenting, she took a public advisor along to a conference with her to present. She was going up and down the country. She was successfully awarded a PCAF, and over the 12-month period of that PCAF, she submitted a clinical doctoral research fellowship, which she got awarded as well. And she started her PhD now. Sadly, she's gone across the border to Manchester, but she's in the right place with the right supervision to complete that PhD. That was a long journey for her. I would say to the point of her PhD, it was probably around 18 months to 2 years. I can't sugarcoat it. It is a big time commitment, and people really need to work hard for these things because the NIHR fellowships are very competitive.
I'll just chip in with something there because Caroline might want to comment later. There's something that was quite high profile in the NIHR called Knowledge Mobilization Fellowships. And people thought they've disappeared, but they haven't. And lots of our colleagues don't realize that they haven't disappeared. So one of the things that we can be encouraging people to move towards from these internships is those Knowledge Mobilization Fellowships, and they are very keen to award them and to make them more visible. So we should be keeping that on our horizon for people as a way of getting that investment in their time and skill building.
Sure, you and Caroline might know more than me, but aren't they sort of at the postdoc level though, rather than the early career?
I thought they fitted across different areas actually. Caroline? Are they only postdoc?
They're in the advanced.
They're in the advanced, okay.
Yeah, so it has to be postdoc. We are going to absolutely talk about those one of the potential meetings, get those September, October, or circulating details. So we're going to get some things where I talk about those things, and certainly that we have a lot of mobilization about that as well. Because I think we have to be big to be to train
Yeah, you're right. Sorry, my mistake. I'd forgotten it wasn't. It's got lost in the bringing together of all the senior fellowships. Mark, sorry, I don't want to cut.
No, just because obviously there are some local authorities. There's now a NIHR local authority fellowships are available free and postdoctoral. So that's where the local fellowships as well. So that's aimed very specifically at people who work with local authorities.
And I think with a heavy emphasis on health inequalities as well, from what I've heard. So they fit very nicely with our member organisations from local authorities to think about if they've got staff for that. Anyway, sorry, carry on.
That's fine. Yeah. Yeah, thanks, Mark. We'll add them into the mix. Yeah, so that's some examples of the different types of internships that people have done, with specific reference to mental health. Just want to talk a bit about the second offer, really, which is the Early Career Researcher Development Fellowships, and these are to enable researchers to develop competitive applications for external funding, and will support the groundwork needed for that. And again, they need to be related to mental health research priorities, aligned to our ARC research themes, be collaborative in that they need to involve more than one ARC member organisation, involve the public and address health inequalities. So that's the kind of main criteria. The fellowship would cover, it would depend on what somebody wanted to do, and they will be quite individual, but it could cover additional research time, release the lead applicants time to work on developing the application, support attending meetings, networking, briefing events, if it was in relation to a specific call, and support engagement activities to make sure that that there's a good public involvement aspect to the application, and could also involve things like quite technical things like IP searches that might need to be done to strengthen an application. They're going to be judged on these criteria, so their relevance and potential impact, their research excellence, their delivery and feasibility. So each application needs to have a management plan to show how it will be delivered. Obviously, the detail about the engagement, involvement, and its relevance to health inequalities. Again, this is just a sort of visual overview of the kind of expected fellowship offer. So it would either be a grant application or an external fellowship application. People would get that supervision and support, either academic or professional, with building a team, addressing inequalities and identifying collaborators, and resulting in either a grant or a fellowship application. We just want to talk a little bit more about two of the components of that, which is the health inequalities and the public involvement aspect, which George is going to talk about.
So all prospective interns, as part of the application pack, will receive a copy of the HIAT. But the current cohort of interns, they're all being signposted now to the For Equity resource that we've developed within the ARC. Now, there is obviously an extra dimension to it now, which is around intersectionality, and I can't remember it. So we're getting them to engage with the HIAT, with the new HIAT. We're getting them to identify those health inequalities and describe them to us at interview. And then we do say to them at the time, these are going to change as you're doing your project. This is what you think they are. But obviously, it's only once you start working on the project and working with your public advisors that you're really going to uncover the actual health inequalities that could exist within your project. But they are front and centre of all the internships that we do, and we do insist that they identify and address those health inequalities as part of their project. Sorry, and obviously, there's some public advisors in the room. Yes, from day one, they are told they need public advisors on their projects. The first question is how many? But we never set a figure to them. We never say you need one or two. There is no real definition there. We tell them that public advisors are recruited and are eligible for payment for their contributions to the project. We obviously tell them that the public advisors will work and learn alongside the other public advisors. There is a very good public advisor forum. That the public advisors will be invited to ARC events such as this one and workshops. And that the role of the public advisor is to co-design that project with them. They're not just research participants or evaluation participants. They're there throughout that journey of what is my research question, what are my methods, how am I going to collect that information, how am I going to analyse it, where can I bring in the public advisor to help me support with that, could they help me with that analysis, as well as working with me on the HIAT. So we go through all of that, and Selina, you did a very good presentation for us recently with the interns to describe the processes to them.
So again, there's these are open for applications now, again with a closing date on the 11th of July. The interviews will be later on for these fellowships. They won't be on the 18th of July. That's just for the mental health internships. Timescales will vary depending on people being available to review them and that kind of thing. We have put all the information about both the internships and the fellowships is on the ARC website. So I've put the links there so people can have a look at that in their own time. We can be contacted on that email address, and we'll have a conversation with you. If you need some support, or if you'd like a form to do an application. And we just very, very much encourage people to get in touch, and we'll support people as much as we can from that point. So that's kind of all the information that we wanted to provide today. So we thought we could use what remaining time we've got to answer any questions that people might have. So,
just want to pose a query to you. Is there any potential to recreate any elements of the Partner Priority Programme based around this opportunity, do you think, or is the pandemic killed that off as a model?
The PPP did start off with a question, though, didn't it? Which was around reducing unwanted emergency emissions.
We could have one around mental health.
In theory, you could do that if that's what the steering board wants, I guess.
Depends if it becomes a more, because there was something about that I think we're beginning to see again today about that potential to fire off between groups and give it more of that group feel, and that the interactivity between groups and the buddying. And I think I'm right in thinking some of that energy still exists in those groups and between those groups that took part in those PPPs. And in fact, the outputs of those have been, because I keep the table still of the Clark Legacy, and there was a lot of outputs and impact came from that work. So I think it's worth thinking about if we can keep that idea alive. But it's partly to know what colleagues here think, whether they think that coming together in small groups in a room around these projects has a merit over a more remote model. Because it needs thinking about and planning and costing if we're going to do that.
What I
Obviously
would
not
say
for the
is,
silence.
sorry, Mark, what I would say, since the advert went out the other week, we have seen a peak in email traffic coming to that email address. There is interest out there. We think clinicians, nurses, midwives, AHPs, they are being encouraged now to do some kind of development. So we are seeing some traffic coming through. People are still approaching us directly and saying, I've just heard about these, or someone sent me this. So a plea to all the member organisation co-leads or leads within the, please send the information out to your staff, because a lot of them find out last minute and come to us 2 or 3 days before the deadline and say, I've only just heard about this. So really, if you sent it out once, send it out a second time, because people do miss emails. So make them aware of the opportunities that we can offer them through the ARC.
I can see Paula wants something and Caroline, but certainly with the early career researchers, because that's partly been run out of Liverpool, I don't mind if someone doesn't want to start this year but says, I want to start next year. It's really important for us to know, if we can, where we're going to plan our resource allocation. There's no expectation that we only accept interest for this year. I'm quite happy to hear from people who say, I can't do it this year, but when things are settled down next year, I'd like to get these agreements in place and get that into my work plan. I'd be happy with that. In terms of the early career researchers, universities obviously employ people as substantive academics to write grants, but sometimes they need time to be brought out of research, or they're not a substantive academic yet, they're at that development stage. And so this is an important opportunity for them. Maybe they're between contracts or coming to end of a contract. And also those academics who are working for providers or commissioners are very welcome to apply for this opportunity as well, to be able to dedicate that particular time to moving them on to the next stage of their career. Early career, postdoc.
Yeah, I mean, I was just thinking about conversations earlier and about, perhaps local authorities having some ideas about what their research priorities might be, or they might not be research priorities, but they might be areas of care that they want to see if there's anything out there that could help them sort out something. And I just wondered about whether people wanted to have an opportunity to discuss some of those things and see what falls out of them, to see if there is something that we could work together on, and if they have a person who might be interested in working with, within a team to actually take that forward.
Yeah. And in fact, I'm going to I've got my funding mixed up.
I don't know what his name is.
The dementia ones, if we get them, have to be postdoc. The mental health ones don't. but then I think we would want someone to have done a master's or equivalent level research training. So they might be writing a doctoral application for a fellowship. They might be writing their first grant. They might be applying for a postdoctoral senior award or a knowledge mobilization fellowship, or applying for a grant as a PI. It's that sort of level. So in academic money, probably not quite senior lecturer, but below, or up to moving to being a senior lecturer at that level, or starting out on that formal pathway of wanting to apply for an academic fellowship to enable them to do a PhD. So it's at that level.
But we
is the
might
early
be
career
able to
research.
make a duet, mightn't we, of somebody from the university that is interested in a particular area and somebody to do an ECR opportunity,
Absolutely.
a fellowship.
It's all
And there
about
might be
teams.
somebody from the local authority who wants an internship opportunity.
Well, I'm imagining these as teams anyway, and you can have more
Yeah.
than one award within a research group who are part of the program. Absolutely. In the PPP, it didn't have to be the lead that was the intern. It could be somebody who was leading an element of a project, a larger project, but needed that extra support to be able to do it. There's nothing that says you have to lead a project to be an intern.
Remember, the idea has to be something that the local authority.
Yes, absolutely. No, it has to be, it's co-production.
Users generating it from an ECR in the university, because they'll think of something that may not be a priority for the local authority.
Yes, but they need to
So
have
we
that
need to get the
conversation.
local authority to tell us what the issues are, and then we need to have a think about,
For the local authority ones, absolutely, yeah.
is there anything in that where we could work together?
Can I just ask, have we had anything come through the chat in the way of questions or any comments or anything? Okay, that's fine. Just introduce you.
Hi, yeah, was there none from the chat now? Okay. Richard Holford, Public Health Consultant at Knowsley Council. First thing, to come back to that, yes, that is really important that we have that ongoing dialogue. And as I've mentioned to a couple of people today, it's been really difficult the last 2 years because of the pandemic. So a lot of the people that are interested in research from a council perspective are public health professionals. So we've been quite busy, as you can imagine. So we're re-engaging with this agenda now. So for example, across Cheshire and Merseyside, we just established a research hub, which is all of the local authorities across Cheshire and Merseyside are putting forward champions to be in part of that, including myself from a Knowsley perspective. And that's going to be working with Liverpool universities and some others. So I think there's a real opportunity to link in with that. We've been asked in this last week for some ideas, and I've put some forward around mental health specifically as well. I did have a specific question though, in terms of the mental health programme, and that's your definition of mental health in terms of our projects, because obviously a lot from a public health perspective are not to do with mental health illnesses as such, but around the social
Mental health
isolation,
and
loneliness and well-being. So does it cover that full
Yes.
breadth? Yeah, okay.
It's mental health and well-being, prevention, community interventions and all of that, because that's what we're strong in this region, rather than big trials of treatment. That's other ARCs are much more into that. That's what you go to the Institute for. For example, in London, our focus is very much around that public health focus of mental health. We have lots of strengths in that, which we really want to build on. So absolutely, that's why it's vital that we have those conversations.
And without hogging the mic, just one final question was around, you mentioned internships and fellowships and stuff, but they are not always the most appropriate thing for a local authority in terms of releasing staff for that amount of time. I know it only sounds like 1 day a week, but it's quite significant that. So are there any other plans or support for local authorities? I know in the past we've had training programmes that have just been delivered, which have been either one-off short ones or slightly longer than that, which have then supported us to. We've got quite a few people that are interested in research, but they need that sort of upskilling and refreshing. So that's my final question. Thanks.
So I guess there's different ways to do that through the capacity building team, and they're able to talk about it. They were talking specifically about this particular investment in building capacity in research and implementation science. nationally through the ARCs. That's what this particular funding is for. That's not the only way that we do mental health research and implementation. It's not the only way we support colleagues. There may well be colleagues in an organisation who want to be part of somebody else's project, so that if they've got less time rather than trying to run their own. And there's always those opportunities, and they may link into these. So if we were to recreate the Partner Priority Programme and there was collaboration, it may be that someone from your authority says, well, can I be part of this, please? And then they're only maybe giving up a day a month or something of their time. It does take it. The early career researcher doesn't have to be so much. It could be that people take a short break out of work to do something for a number of days a week and then go back. It doesn't have to be for a year. There are different models.
Midas team, a whole series of methodological.
Sorry, hogging the mic again. So Midas have a whole series of seminars around different methodological things about research.
Yeah.
And I'm sure everybody would be quite happy to try and think about how those could be. I mean, they are offered out across the membership anyway, so people can join because they're available online, aren't they? And also, I'm sure that people would be willing to set up ones that, where somebody else has set the agenda and we've done something tailored towards that.
I can see that need Mike down here as well. While Paula as well. So while we're doing that, the EPIC theme, Equitable Place-Based Health and Care, has run some one-day courses, logic models, etc. Communications team, Darren, I don't know whether it's in the room or downstairs, they've done, as have the EPIC team, things on using social media and getting your research out into the world. So there's lots of different ways that we've offered one-offs or bespoke training, but absolutely those Midas, there are regular seminars, and there are other ways, but always happy to hear. I would really keen that we link, if we can, that group you were just talking about with those champions into the ARC and encourage them to get involved in both the Improving Population Health, the Equitable Place-Based Health and Care theme, or any of the themes, and come along to those meetings so that we tie that together. Because the whole point of the infrastructure is it enables that cross discussion. I'm anxious that we start having silos trying to do the same thing. That's the last thing we want, really. There aren't enough of us to try and do 4 different things at once. There's Darren. Yes.
Hi, it's Nanette again from the Brain Charity. It was just a comment really to say that we have got lots of ideas of things that we think need to be researched and looked at. I could reel you off 20. I understand that there are huge numbers of children with ADHD being expelled from schools within Liverpool. And why is that? What exactly leads to that, and what can be done about that? From our client group, we hear constantly that they are going back and forth to their GP, sometimes for years before their neuro condition gets diagnosed. Again, what's going on there? Why are there only, I think it's about 40 neuropsychiatrists in the whole country, so whenever anybody goes for some mental health treatment, the focus is always trauma. And it's never, oh, hang on, there might be a neurological condition in the background here, which is causing the depression or the anxiety. So there's lots and lots of questions that we want to ask. So the opportunity to kind of pitch those ideas and get an intern to do them for us is attractive. It's not attractive for us to have somebody internally doing that because all of our staff have got jobs to do. We've got waiting lists all over the place, and it would just be very, very difficult. We have got some part-time staff who might want to take on an extra day, but generally speaking, They might have a degree. There's probably a few MAs knocking around in our organisation, but I don't think
That's
we've got
fine for
any
an
doctors.
intern. It's the early career researchers that usually have to have that basic research, more advanced research training, but for an internship, absolutely, that's fine. I guess it's about, the internship is about enabling, building the capacity within the organisation or with other organisations around that question. So
I do understand that, and I can see that we would be building up our capacity to research, but at the same time, we would be depleting our capacity to offer the direct help that people need right here, right now. And that would be the decision that I would have to make.
Yeah.
Do I take this person away from completing welfare benefit forms for somebody who's living in poverty and put them 1 day a week on researching why they're in that situation? So that it is difficult.
So absolutely, but that's why we offer the £6,000 to the member organisation, so they can either backfill them, or if they're part-time, that they can give them more hours. So it's not.
Yeah, backfilling a 1 day a week job is not easy. So just thinking about it in practical terms again.
I know it's more difficult for smaller organisations, but
it does feel a little bit like the model has been built around academia again, and it doesn't really fit in with the way that our organisations work.
I think it's been built around larger organisations, to be fair, rather than, it's not built around academia, because academia doesn't work that way either. It's very much built around a provider or a commissioner who can, to buy somebody out of, to do a development piece of work for a period of time.
And that's great if that's what you wanted, you know, if you were looking to engage with
But
those
an
local-
organisation like yours, we can talk, there is an opportunity to collaborate with other organisations and to find a professional who shares that interest and concern, to learn from the expertise in your organisation, for people in your organisation to be involved in the project, but for somebody else to do the internship and do a lot of the
which would be more attractive.
Yeah.
I think you mentioned, George, briefly about public advisors potentially doing internships.
Yep.
I know I've had one of our public advisors today said, would I be able to do that internship? I realise probably that they need to be coming from the member organisation. I'm just also speaking on behalf of the public advisors in the ARC that maybe aren't necessarily working in one of our member organisations. You know, is it possible for them?
In the past, we've arranged, haven't we, that they have a contract with them so they can get that income.
Okay. Or they could collaborate with a member organisation.
Yes, they need some sort of way to route the money through the member organisation. We can't give it directly to the member of the public. That's the problem.
I was just thinking of that for the Brain Charity, to be honest with you. Would that be a way that you could perhaps get a piece of work done? And don't think of it as just research. Think of evaluation, think of it as implementation. Because otherwise, if you say the word research to someone, it'll scare them away. If it's to evaluate something that we have to see if it's actually working, that's something different, isn't it?
I was thinking about that. That's just my needs as well. It's, you know, to be able to deliver services. So we can deliver.
Sorry, if we can deliver perhaps a new innovative piece of work and research that at the same time using this money, then that would tick our box as well as yours, I guess.
So what the NIHR can't do is pay for the implementation itself. That's outside the rules. We can pay for the evaluation of that or the research into that. What we can't do is pay for the actual service. That's what the co-funding is for. And they're quite strict about that. Because the NHR pays for research and research into implementation, we're not allowed to pay for the implementation directly using NHR funding. Hand's been up here for some time and I'm getting evils now. So,
Yeah, if we could finish with this question.
I think it's fair to say that there's a space for intern, early career, that, you know, Nanette, Richard and others are saying, and Selena are saying, where can we curate that? What does it look like? The Coran. So we've got a community research and engagement network is basically led by the VCFSE sector. We pay, you're right, Nanette, we pay for their expertise to sort of begin some of those early conversations, as you were alluding to, about what are your priorities in the places that you work. Absolutely recognise lots of them are on grant, the staff are on grants. They can't go anywhere else because they've got to deliver on key objectives. But certainly from the clerk and the coroner in the clerk has moved on massively. We're absolutely wedded to get public community-led research conversations in that space, coupled with what's the system talking about its needs are in terms of research, skill development. We're connected to the Cheshire and Mersey Research Hub through a DPH, IFOMA, and obviously we've got a colleague based at Lancaster that's leading some of that. Similarly, we're already connected as well into some of the Lancashire and Cumbria ICS conversations that are happening in this space. They're talking and mooting about developing a health and education academy. Again, to have some of these conversations. So my offer to people who are thinking they're really interested in this, but maybe not yet, what does it look like this time next year? When we share things around the Community Research and Engagement Network meetings, please come along, because we do not set the agenda. We ask for the system to talk to us about what its research priorities are and its learning and skills opportunities are. So come and have a conversation with us, please.
And those questions can be raised with a theme, and then the theme staff can come and talk through and see what stage it's at and where it can go to develop something, and see what interests in other organisations. We're moving somewhere away from your focus, though, so I'm going to leave you to finish us off, if that's all right.
Do you have anything to add?
Just to say, I think we're due downstairs about now, to be honest with you. But thank you very much for your attention. Any questions, do email us. If you need to talk to us on the phone, you need to talk to us over Teams, just let us know and we'll arrange to do that with you. We're happy to discuss any potential projects with people interested in the internships. Sometimes the idea that you come to us with changes into something else after some discussion. But again, it needs to be something that's manageable and deliverable within the time frame.
Can I just thank you once again for the great presentation, very interesting. Hopefully lots of good ideas will come to you from it.
Thank you. Thank you very much. Sorry.